I'd like to call to order, please, the work session on Monday, April 21st, 2014, 5 o'clock. Joanne will not be joining us. Councilman Osborne will not be joining us this evening. So let's go with the first agenda item, and is there a presentation and discussion of the health care program of the City of Goodyear for alternatives, for the fiscal year 2014-2015. Lyman Lockett, HR Director, to present. Lyman?
Good evening, Madam Mayor and Council. It's a pleasure to be here this evening to talk about our medical insurance renewal and an update on compensation. I do have some folks here joining me. We have members of our insurance committee, number of members. If you want to stand and be recognized. Yay! Yay. And I also have Ray Brandenburg from Cigna and Rick Shuckero, our broker consultant.
Welcome, Ray and Rick.
So there you go. I'm going to jump right in and very quick agenda, give you a background on where we've been and where we're at today. That'll include a little bit of information, employee feedback. We'll talk about the medical plan renewal. The proposed plan designs. I've got some benchmark data to share with you, a brief presentation on compensation, and the employee impact of both the health insurance plan proposals and our compensation proposal. Leading up to where we're at today, there were a number of things that have taken place since we started this plan year back in July 1 of 2013. It had a little bit of a rocky start as we started this past year, and we've been working very closely with Cigna to take care of some of the issues that transpired at the beginning of the plan year. We feel like we've addressed a number of issues, and we've got plans to address some of the things that have continued on a go-forward basis. We've contracted with a new broker, Rick Shuckero, with the Levitt Group. We held a council work session back in January and updated everybody on insurance. We'll give you a further update today on where we're at and what we're proposing. We conducted an employee benefit survey. I'll give you a little bit of data. We shared that data with you earlier, but there's two key points that we'll focus in on that have led to our proposal. One of the more exciting things we did, we recommissioned a newly formed insurance committee, and many of the members are here, as you saw. We prepared them to go out and engage with our employees and get a high level of engagement from our employees. That included preparing them to understand insurance, how it worked, how our plans work, to hopefully better educate our employees, and ultimately take out these two plan proposals and get their feedback. We relied on them to engage our workforce, and they did a great job. We heard great feedback from throughout the organization. We had coverage from all departments, including sworn and non-sworn in both fire and PD. So we think the feedback that we got was very good. And lastly, we conducted two open house sessions. We wanted to give employees every opportunity to provide feedback and make sure that we heard their voice. With regard to some of the feedback, there were really two significant areas that I want to focus on. This feedback that you're seeing here came from our employee survey. And as you look at this, we asked the question, if you take our health care insurance, to what extent have you been satisfied with Cigna, our health insurance provider? And I think one of the things that begins to stand out here, and I'm trying to move the cursor here, our highest level of satisfaction, group with the highest level of satisfaction, were the employees that are in our HSA 1250 and 2500. In that group, we have a 91% satisfaction level, and 28% of those, while satisfied, feel like we've got some work to do. Our second highest level of satisfaction was in our HSA 2400 group. Again, very strong numbers in that area. And our lowest level of satisfaction was in the CMG plan. Still a high level of satisfaction. 74% were satisfied, 40% were satisfied, but cited need for improvement in some areas. So that was a target area as we worked through this, and it validated some of the things that we were hearing from our employees about some concerns with the CMG plan. Another area we looked at, we asked our employees to rank by level of importance what most influenced their selection of an insurance plan. And the top three were cost of the plan premium, out-of-pocket maximum cost, and ability to select a doctor. Again, these two areas.
Joe
Yes.
has a question. Joe?
What is the rating, 0 to 8?
It was actually a ranking of importance, so every employee ranked by level of importance all of those things, and it factored out the way you see it presented there. So 6, if I could probably break this down the easiest, they ranked cost of the plan premium 6 points. It got 6 points, I guess.
You don't have to get into 10. The only reason why I say it seems like the top three pretty close.
Yeah, the top three were pretty close. I guess there is some significance there, though. If you look at the data and the numbers, the way that they broke by level of importance as you work down that scale, those things that are at the bottom of the list were ranked by the groups that are in our high deductible plans. The HSAs, people that were in the CMG, they didn't find any importance in the HSA. So
it could have skewed it a little bit.
So it did skew it, and if you break the numbers down, I would say that those three that are at the top are significantly more important than others.
And that's the point I was trying to make there, that it seems like not just the cost, but the ability to select doctors also is there.
Certainly was an area of importance. A quick overview of our medical insurance renewal, starting with our current plan. Our current plan design, just a refresher on where we're at right now. We've got the three plans. We've got the HMO. The HMO has a $750 or $1,500 deductible. That's employee or family. Co-pays of $20 or $35. And we've got the two HSA plans. The HSA with a $1,250, $2,500 deductible. We contribute $300 and up to $900 into an employee health savings account in that plan. And then we've got our 2,400 HSA plan, 24, 4,800, and we contribute 600 all the way up to 1,800 to the employee's health savings account. Both those plans have a 90-10 co-insurance, so employees pay 10%. Once they hit the deductible, the insurance picks up 90%.
Sherry?
With the HMO, I just want to make sure I'm clear because it follows up on Joe's question about keeping your doctor. With the HMO, my understanding, and I know this is where kind of the issues came in, is you have to go to an HMO facility with the doctors there. Does that also include specific Cigna hospitals, or can you use any hospital?
The HMO plan has a contracted group of doctors, both at Cigna facilities and non-Cigna facilities. So the vast majority, though, are at Cigna facilities. So typically our employees are going there. Many of them are going to our healthcare clinic. One of the things that we found encouraging from our survey is that 66% of our employees on the CMG plan have actually selected our healthcare clinic as their primary care facility. They can refer to specialists from there. They are a Cigna primary care provider. So we found that encouraging. So that's another option that's available to them.
How about the hospitals?
The same.
The hospitals.
Same would hold true for hospitals.
So you'd have to look ahead of time and just
Absolutely.
make sure it's contracted under the plan.
Absolutely.
Okay.
And that's some of the educational pieces that we're going through. As we roll this out and as we talked about it, we were hearing from employees about a desire to have a broader network. So back to that employee selection, we were hearing some desire to return to an old PPO-style plan, and I'll talk a little bit more about that.
Wally?
Hospitals are the same if you're in HSA or HMO. They're the same, according to.
Okay, yes, the hospitals are the same. Just to clarify, the hospitals are the same regardless of whether you're in the HMO or the HSA.
Okay.
If that, does that clarify?
That's just what I wanted to
Okay.
So can you go to any hospital then?
You can go to any hospital, your providers, and for emergent care,
Yeah.
you're covered
Okay,
under all the plans.
okay, because I was just following up with Sherry's, is that if you're in an emergency and they're taking you to a hospital,
Right.
and if you're not talking, you're not going to say, hey, I can't go, I have to find a
Right.
Cigna hospital.
That's correct, yes, for emergent care, whatever
Just
facility you're.
The closest facility.
Absolutely,
Okay, thank you.
absolutely.
Joe?
Just to follow up, and again, on those key issues that we were working on in the prior year, still, when it comes to medication, they can get their scripts outside of a Cigna pharmacy, that's still good?
That's correct.
Okay.
That's correct.
And as far as specialists, if they have something significantly happen to them, they can get recommended, even though it's in the Cigna network, outside of the Cigna facility for a specialist, is that correct?
And I'll have, that's correct, yes.
Okay.
I'm relying on Ray there on that one, but that is
The
correct.
two Rays were, the two Rs were.
Because I think that was a concern
Yeah.
last time, a little bit, so, okay.
And I think as we've worked through it, and I think that's one of the issues, the referral element of it was something that we also worked through with our healthcare clinic so that we could have a more seamless referral process. So we've worked a lot of bugs out of that, and we feel like that's water under the bridge with regard to referrals.
Yep.
Go ahead.
So, a quick look at our current plan. So, moving into the renewal, the basis for the renewal that we'll talk about, unfortunately, starts with our current loss ratio, or the loss ratio at the time, which was 96.18%. Essentially, every dollar we paid Cigna, 96% or 96 cents went out in claims. So that's not where we want to be. Cigna obviously would like that lower. They'd like us at 83%. It's one of the areas that we're working on, and one of the areas that I think we can leverage our clinic more and our wellness program more to bring down. But this is a factor, a significant factor in our renewal. That brought our target renewal increase, and I'll talk a little bit more specifically about these numbers when we start looking at the plan, but it brought our target renewal to 15.87, and if we stayed status quo with the same plans that we have, it brought it to 11.32%. A few other elements of our renewal were large claims. We had two large claims that were projected to go into this next year and probably exceed $100,000 as well. So that actually we got a concession on that through the negotiations. And then the other element of renewal, which is very important to us to keep our wellness program moving forward, is this also does include the $50,000 in wellness fund dollars.
Thank you. Go ahead.
So, the proposals, proposal number one is the status quo. With this proposal, as I mentioned earlier, there's a total increase to the city of 11.32%. That breaks down to $733,000 increase for the city, or excuse me, total, and $610,000 for the city, $113,000 increase in employee contributions. Essentially, if you look at the plans do stay the same. There is one bullet here. If you look at the HMO, the fourth bullet, there is a change here. One of the things that we worked through in this past year, Cigna had committed to employees that they could maintain the pediatricians that they had, and they were doing some things behind the scenes to make that work. So there were some glitches in that. What we're going to be doing going forward is Cigna has contracted with 3 new medical groups, 3 new pediatrician medical groups, and that's adding 77 doctors to the network. We feel like that'll certainly give us broader coverage. It might result in some employees having to change pediatricians. We understand that. We'll inform employees of that prior to open enrollment, so they're aware of that. But
Bill?
No, go ahead and finish.
everything else with these plans stay exactly the same as they are today.
Go ahead, Bill.
Okay. Lyman, we did not increase the percentage to the employee in this year. We didn't cost shift any additional percent.
In this proposal here?
Yeah.
No. No cost shifting. Our
In any of the
cost-
proposals.
when we get to proposal 2, I'll talk about a buy-up. One of the plans is modeled as a buy-up plan.
But that's an employee choice.
That's an employee choice, absolutely. Otherwise, there's no cost shift.
No additional cost
to
shift at
employees.
this. Perfect, thank you.
This gives you a look at premiums based on our Plan 1 proposal. Again, everything stays the same in our Plan 1 option. So you can see our current employee-only contribution for the various plans in this first set of bars here, and then the next set of bars will be employee-only, their new contributions, and so on and so forth. So for the HSA 2400, employee costs are going to go up just under $2 per pay period. So you can see the change throughout.
Joe?
Just a quick question, is pre-tax, these two comparisons?
Yes, pre-tax.
So in essence, it's not going to be as large of an increase because,
That's correct.
yeah, it's not taxed, okay,
That's correct.
all right.
Plan 2 option, and the Plan 2 option brings a PPO-style plan called an IPA. Signals World, it's called an IPA. We heard a lot of voice about bringing back an IPA. We didn't know how significant that was, and as a result of that, we asked Cigna to price it. So this plan option does include the IPA. The IPA is positioned as a buy-up, and you'll see the premiums for that in a moment. The IPA, this plan option has an $800 individual or $1,600 family deductible, co-pays of $25 and $40 for primary care, and then for specialists respectively. And the ER and the urgent care co-pays you'll see there as well. The thing that we did with this plan model is we collapsed the HSA, so you'll only see one HSA option. The HSA option is a $1,500 and $300,000 deductible.
Of course.
That could be very scary. $3,000 deductible. And the HSA contribution from the city is $500 for individual, $1,000 for family. And it has a 90/10 co-insurance. Out-of-pocket max for this plan is $200 or $4,000. So it is a kind of a blended version between the two. We did look at satisfaction levels in terms of that plan option, and we feel like people that are in that plan option will still be satisfied. One I guess, point of consideration in this plan model is employees that were in that high deductible, the 2,400, 4,800, they're probably the most impacted as they move into one of these other new plans. Their premiums will go up higher than the others, and certainly as a result of that, their deductibles do come down. Couple of points on this. The HMO, I should talk about the HMO. The HMO is exactly the same in this plan as it is in option 1. So there's no change at all in premiums or in the coverage. The committee had a lot of discussion about this, about the aspect of bringing back the IPA. This IPA is essentially the same IPA or PPO plan that we had a couple of years ago. Some of the concerns that the committee voiced were The IPA, the PPO-style plans tend to drive more utilization because they're co-pay model plans. So people are not always conscious of the actual cost of health care, and sometimes it can drive up utilization. The committee was very conscious about the potential to put this on the table and then have to come back maybe a couple of years down the road and take it off. So that was a concern that they were left with.
Sherry?
For the IPA, sorry. Where were you helping me? For the IPA program, when you do that, it looks a lot like the HSA with the picking your doctors. But is there any coinsurance at all, or if you go to the hospital 10 times, it's only the copay?
Yes, copays, you're paying the copays for, your copays continue, and the deductible, your deductible covers hospital, radiology, and diagnostics. So anything else, you'll continue to pay copays on.
So I just want to make sure we're talking about the money. Once we get to, for the IPA, your family $1,600 deductible, there's no 10% or 20% co-insurance after that point? It's just the deductible? Or just the copay at that point?
It's just the copay.
Okay, so that's why you're saying it could cost more if
Exactly.
a lot of
So, yeah, if you
utilization.
continue to use services, you're going to continue to pay through copays.
Wally?
For option number 1, how much is the prescription cost, copay for formulary and generic and?
No, there's no change in our copays for pharmaceuticals, and let me get you that number. For generic, 25, formulary, 75, and non-formulary, 125. That's for the mail order. For retail, it's 10, 30, and 50. And
It's the same price it was?
10, 30,
now?
and 50, exactly.
Okay, perfect.
Okay.
Thank you. And they can go to any pharmacy?
They can go to any pharmacy. That workaround will stay in place.
Okay.
So, I think the committee, I guess the other thing that I would say with regard to the PPO is the committee had those concerns about what it might do for utilization. Again, it is positioned as a buy-up, as you'll see on this next slide. This slide reflects current premiums again versus new premiums. We don't have the IPA, but you can see that for employee-only per pay period, the premium is $32.23. It is higher than you'll see with some of our other plans, so again, it's positioned as a buy-up. We think that, and one thing I'll add is these plans are priced to be self-sustaining, so Cigna's priced them that way. Doesn't mean that utilization might go up. Utilization could go up in any of the plans, so we're conscious of that. One of the things that we did consider is with the IPA, employees might see, if the utilization goes up, they're going to see a cost increase here since it is a buy-up, so.
Bill?
I missed this earlier when going through it. We've got the new in that column? Employee, spouse, new?
Yes.
Is that a new employee compared to a current?
That's the new premium.
Oh, the new, I don't know why
Yes,
that's just catching my eye.
current premium versus the new premium.
Okay, so where there's none, that's the new IPA.
Exactly.
Got it.
Or the new
Or
HSA
the new
1500.
Okay, sorry, thanks.
Okay, and a quick recap, so it's kind of a side-by-side comparison of option 1 and option 2. As I mentioned earlier, we commissioned the insurance committee to go out and get feedback on these options. They took them out to the departments, met with their department personnel. They did everything from one-on-one meetings to group meetings and brought back feedback. I'll speak to the bottom of the slide there because it's cut off a little bit. But what we have here, looking at the feedback coming back from our employees, for option 1, we had about 73% of the organization that were opting to go with option 1, and about 21%, just under 21% opting for option 2. And then we had about 7% that opt out of our insurance. We think most of those individuals are currently opting out, so we're not thinking that that's a reflection of the options, but they're currently opting out and will continue to opt out. We thought this answered some of our questions with regard to, what level of desire was there in the organization to bring back the IPA. We didn't think it was as significant as we thought it was. Also, looking at this data, you might notice that we have some areas that are low in terms of response. Fire, if you look at our fire department, those numbers are low. And I will tell you that there was a full court press put on to get feedback. In fire and some of the other areas, we did have a number of employees that were non-committal about what they wanted. One of the things we found that in our largest group of employees that fit into the HMO plan, we've got about 280 employees in that plan. Many of them didn't care one way or the other because it doesn't really matter whether they're in option 1 or option 2. So some of those folks didn't give voice, but you can see some areas where people didn't have an opinion one way or the other, or didn't provide an opinion. So moving on to some benchmark data to see how we're compared against some of our benchmark cities. We can look at our premiums, and this chart here reflects our premiums, and these are for our new plan premiums compared to current premiums in the other cities. So you have Goodyear up front here, and then you've got the average. We think we're still competitive, certainly competitive with employee only. We look a little high in some of the other areas, but again, we're comparing our new premiums versus current premiums. So once we're able to get data on movement in some of our benchmark cities, we still feel like we're going to fall into a competitive position here. One of the things you might notice is Avondale. Avondale, their premiums are extremely low. What we asked for in this survey is we asked for everyone's lowest plans, their premiums for their lowest price plan. Avondale has a plan that has a $3,000 employee-only deductible, $6,000 family deductible, and they've got about 20 people in that plan. So, as we compare these numbers, sometimes it gets a little difficult looking at an apples-for-apples comparison. You got to look at the plan model and understand what it is. In this particular case, it's a plan that they're indicating is not well utilized, and it is a high deductible plan versus our HMO plan, a high deductible plan, I should say. So, we also looked at the types of plans offered. So, of the 11 cities we surveyed, 8 offer a PPO plan, 4 offer HMOs, and 4 offer high deductible health plans. Next, we looked at our comparison of our medical insurance increase. And as you can see, we're looking high in comparison to other cities. We're at 11.32, and these are projections for other cities. Some don't know where they're going to land. One of the things I'll point out is at the bottom here, we're also showing the various funding models. The city of Goodyear and the city of Buckeye are the two only fully funded models. So it's an area of exploration for us in the future. Certainly not a silver bullet in terms of bringing our costs down, but we think it's something that needs to be explored. We also have Avondale, who is in a consortium. So that's another area of exploration that we think we need to be looking at in terms of driving costs down. We still need to get to a point where we're balancing out our loss ratio. Once we can get to that point where we are not having fluctuations in our loss ratio, we think it's time to potentially look at moving to a
Bill?
different funding option.
Lyman, when do you, we've talked about this for a number of years. When do you think we'll start looking at that? Was actually very surprised to see this, the number of self-funded communities, especially our benchmark cities, that, I realize you're trying to wait for the loss ratio to balance out, but I think if you look back over our 8 or 10-year history, it's probably as balanced as it's going to be, unfortunately. So do you have a timeline in mind? Do you have, is that this fiscal year coming up? I'm not going to hold you to it.
Yeah.
I'm just looking for no, it's 5 years out, or it's right around the corner.
It's something that we're going to study going into this next year. As I mentioned, it's not a silver bullet in terms of bringing our costs down, but we think that we can look at different funding options that we could bring back to council. There's partial funding. There's different ways to move into it so that we're not, getting involved in large risk. So there are different ways to move into self-funding, and we think we can come back with some things that we can consider. I know that our broker has done many transformations into a new funding model. So we're going to be working with him over the next year and looking at some opportunities and bringing those things back to council.
So what I'm hearing you say is we may hear some information this time next year. May hear some information, not
that we're definitely going to do it. I think it.
We've looked at this year, and this is what we found.
Yes, this is what we found. I think it opens the discussion to talk about funding models. I can't draw a specific timeline on when we want to, but it certainly will. We'll be sharing more information on what we're finding, where our opportunities are at. There are so many different ways to move into self-funding. We also, as I mentioned, I think there may have been interest in studying the consortiums as an opportunity as well. We do have data in that regard as well. So I think we want to look at everything. One thing that we know is that, two things I think that are very important. One, we're not getting the full return from our wellness clinic when we're in a fully funded, fully insured model. And second, with all the things that are going on with healthcare reform, as our broker always talks about, walling ourselves off from the rest of the world, it gives us that opportunity to wall ourselves off. So it's something that we certainly should be looking at. Obviously, 11.32% increases are unsustainable, so we want to be looking at different things, and we'll continue to do that throughout the remainder of this plan year.
Great, thank you.
Joe?
Before you leave this topic and go to the next one, just had a couple questions. Is it Ray and Cigna? Yeah, a couple questions for Ray. No,
It's Ray and Rick.
Ray and Rick? Okay. The two R's. Obviously, healthcare is at the forefront of a lot of things that are going on right now. So a couple questions for you. Do you think we'll ever see the pricing sheets at the doctor's office or at the hospitals, some of the things they've been pushing for, so that when consumers go in, they have a general idea of what they're paying for in the industry? Do you think that may happen?
Yeah, that's actually happening today.
Okay.
Cigna has some transparency tools, which 5 years ago were unheard of. But through mycigna.com, you can actually go in and see some of the contracted rates, which were proprietary, confidential at one point. We do it with a full disclosure to prescriptions, so you can see the pricing from various pharmacies across the valley. And we're getting to that level with physicians. One of the restrictions is some contracts that are in place still prevent some of that disclosure, but healthcare reform is pushing towards transparency, so you're going to see more and more of that as we move forward.
The only reason why I ask is to be helpful. I know we've run into some instances at times where it was hard getting some of that information from the providers. They just wouldn't share that. Are you part of the exchange? Is Cigna part of the
Yes.
exchange?
Yep.
Okay. Next question is the future as a result. I guess this is the first year of the exchange, so it's kind of hard to know what that makeup is, or whether there's going to be a lot of subsidies, or whether your costs are going up. A lot of still stuff in flux. Any idea where you think this may lead the overall, or how this may impact the employer plan going forward?
No, I think it's still so early in the game, and some of the rules continue to change on a quarterly or monthly basis as far as what some of the mandates are and what coverage levels are required. So I think it's going to be a multi-year rollout. I think what we have to figure out first is what's the level of adoption, who's moving into it, who's interested in it, and then once you're in it, if it goes sideways, what does that mean, for you as an organization? So, the early adopters are still kind of typically the organizations that view it as their only kind of last chance in the free market to try to find something that might be the competitive answer for them.
Yeah, and I would assume if you're taking losses on one side or not taking losses, that somehow it's going to trickle down into your employer plans. I would make that assumption. Is that fair?
Yeah, at a fully insured level it is. Cigna's majority of our business is self-funded, so from a risk standpoint, Cigna's not as exposed as some of our competitors are.
That's good to hear.
Yeah. Okay. Thank you. I appreciate it.
Any other questions? Thank you
Thank you.
so much for coming to the table on that.
Okay. I'd like to move into compensation. And just reflect back on council interest. Going back to prior to my arrival, council had expressed a number of interests. One was a structure that could move non-sworn employees closer to market. We wanted to eliminate steps. We wanted a flexible plan, one that was explainable, defendable, and legal. So we implemented a new pay plan, and I'll talk a little bit more about how that's working. But as we move forward, I guess the first piece I want to talk about is the proposed salary increase for our fire and PD. Per the MOU, they did not receive an increase last year. This year will be the first year of the contract, if you will, so they're due a 5% or one-step increase. So that's consistent with the MOU. Employees who are at maximum will get a 5% lump sum. So consistent with the MOU, pretty straightforward for our fire and PD sworn personnel.
Mayor,
Bill?
I just want to kind of reiterate that point for the public, that there was no pay increase in the MOU for this current fiscal year, that both years combined were pushed into the second year, which is how we get to 5%.
That is correct.
Thank you, Bill, because I'm sure we'll see it in print if we
5% looks like a big number,
specify
but
that.
it's been
Yeah.
spread out over 2 years, so
Right.
it's really 2.5 each year. They just waited.
Thank you.
And for our non-represented employees, and this gets into the pay plan that was introduced, just a memory refresher on how the plan works. But for our non-represented, what we're proposing is a 3% average increase. And the way this works is there is a different increase is given based upon the quartile that you're in. So for employees that are in the first quartile, they would receive a 3.55% increase. Those in the second quartile, a 3.15. Those in the third quartile would receive a 2.9. Those in the fourth quartile would receive a 2.3% increase with a one-time 0.5% lump sum payment. And then those above max would receive a one-time 2.8. So structurally, this gives us an average increase of 3%. That's our proposal for our non-sworn personnel. One of council's interests was, and one of the contributing and most important factors to this new pay plan was the opportunity to move our employees quicker to market. And just want to talk about how that's working. based on this new proposal. So if we look at where we're currently at today, as of February the 4th, we had 156 employees in the first quartile, 68 in the second, 48 in the third, 22 in the fourth, and 16 at max. If we look at where we're projecting this new salary increase to come into play, we see movement in the direction that we'd like to see movement. So we'll have 114 in the first quartile, 98 moving closer to market, and then small numbers moving in that third and fourth quartile. So the system is working. We're pleased. We think that this meets the council interests that were mentioned earlier, and it also moves us along incrementally in the direction that we want to move in versus some of the cities out there moved along and they kind of ripped the Band-Aid off and they had large increases last year. We thought it was more appropriate to do incremental increases, and this is reflective of that. A little bit of benchmark data, if you will, or just some comparative data. This is what we've been able to gather so far from some surrounding cities and what they're projecting for pay increases for the next fiscal year. As I mentioned earlier, you can see we're there at 5 for fire and PD and 3% average overall. And really, I think if you look at where this group of cities are, we think we are competitive with regard to our proposal. I do have some other information. If you could pull up Elmo, that gives us a look at, kind of a historical look, if you will, at where increases have gone. Again, looking at our benchmark cities and looking at the city of Goodyear, going back to 08, 09, where employees got a 1% increase, and then we had 3 years of no increases, and then last year and the prior year, a 2.5% increase. Again, you can see where we're sitting in comparison to other cities. We again think we're competitive with regard to our proposal of a 3.0 average increase for this coming fiscal year.
I have a question.
Yes.
In looking at fiscal year 11-12, and it shows Phoenix a minus 1.54, that mean they took 1.54 back out of their salaries?
That's what they have provided us. I know that they did some furloughs and some other things.
And that's how they, well, I know, I mean, looking at Glendale, yeah.
Yeah, you know, there's a lot of activity going on through these years, including furloughs and some salary decreases in some cities.
Question.
That's probably what.
Joe?
I'm sorry. That's all right, that's fine.
Joe?
It's my understanding Phoenix was still going in their STEP program all during this time, so this is kind of misleading.
Yeah.
Yes,
It is.
yeah. I'm not sure what to say about the math there, but
Okay.
those are the numbers that they provide, and that was my understanding as well, as there were increases that were happening during that period of time.
Sherry?
Having several good friends that still work there, I'm working there for 13 years. Not everyone is in the STEP program there, the way they work. They have lots of MOUs for different areas, and then a lot of people aren't in the STEP program. Those people did have to take furlough days, and actually some of them got so much off their salary. So theirs is really hard to compare to ours because it's so much different than, you know, how ours is. So I don't know if we compare. But I would like to ask about Buckeye, if you don't mind.
Sure.
They're not up here, but they did something. They only have 1% this year, but they did something last year, right?
Yes, yeah, Buckeye had a significant increase last year, and I don't have the number, but they were one of the cities that ripped the Band-Aid off, if you will, and they gave a rather large increase, as did Tolleson, Gilbert, So there were some cities that gave significant increases last year.
Thank you. I just want to, so if someone sees 1%, they're not like, well, why are we so different than our neighbor? People know that they got it last year, and we got not very much last year, last couple of
That
years.
is correct. And the next several slides, we look at employee impact to see what happens with the insurance, the increase in our medical insurance versus this projected salary increase. We looked at our lowest 5 paid employees, and I'll move through this very quickly. These 6 slides are different scenarios based on employees moving from one plan to another or staying in the plan that they're at. The first 3 are for the option 1 proposal, and essentially what this is reflecting is for employee only, for this individual, their insurance goes up $2.17, and they would receive a salary increase of $42.15. And then you can see the net there. The green bar essentially is the net. And you can see throughout, regardless of which plan they're in, whether they're an employee only, employee and spouse, employee and child, or employee and family, they're staying net positive. So that's what we're looking at. This doesn't include any increases in ASRS and any other things that might impact pay. This is just looking at health care or medical insurance, and in this situation, again, HMO to HMO.
Joe?
And this is your gross amount, right?
This is gross. That's
I'd
correct.
take another 60% of that to probably be net.
Absolutely. So, yeah, they're going to be impacted by taxes, so the numbers you see there, that's not their actual take-home.
Paying taxes each
Well,
time,
you've
Joe.
got the ARS
Yeah,
that's
I
at
don't
about
think you can get out of
12%
that one.
now.
Sherry?
I'm just trying to compare apples and apples here.
Okay.
So
I'm
you got
kidding on
39, but in essence, what's going to end up in the pocket is probably closer to $18 or $20, something like that.
Which leads me to a tax question. You're giving me all these great questions. With the taxes, I've heard about under the new Health Care Act that some of these health care plans are going to be taxed. Are there more taxes for our plans, or do ours fall outside that?
Our plans fall outside that. We wouldn't fall into what would be considered a Cadillac plan, so there's no additional taxes or impact to our employees.
Say that again, we're not.
We're not, yes.
Joe?
Another question. And I don't know if this takes effect or not, and I'm not sure if it's for Ray or not, but it's my understanding is at some point, they were going to make taxable that contribution that, what employees are getting as a benefit for health care. Is that still on the table, or is that happening a couple of years from now in the implementation? No?
That was talked about, Vice Mayor,
Okay.
through the negotiations of ACA.
Yeah, would you just come up and sit on the mic, because that's very important, because we have heard that in many conversations going around the city, so.
Yeah, that was an option in the whole passing of the Affordable Care Act, where they did talk about taxing it for employers, and did not pass. That did not go through any of the legislation.
Not one of the things they've changed. It's
No,
just
it is
never
not.
actually was implemented. Okay.
Correct.
Weren't they also looking at the share to the employee as part of their income right now? It's not part of the income. Weren't they looking at that as well?
Well, they were looking
Okay.
at both, all the tax implications of the employer and the employee.
But that's off the table?
But it's off the table,
Okay,
as we understand it now.
Okay, thanks.
And
Wally?
I probably should have asked this early on, but because we're being, our increase is now 11.6% or 11.63, is it because of the Affordable Health Care Act that it's going so high? What's the bottom line? I mean, why is it, what's driving it to be so high?
Well, it's the claim base running in that 96% loss ratio is driving most of it, but the renewal does include up to 4% of the increase is for the Affordable Care
That's
Act
what I
because
thought.
the employers are paying for the system, the exchange system.
One doesn't know the catastrophic incidents that happen through the year, and I think of heart attacks and cancer patients and you name
Right.
it. Doesn't that affect that 90,
Yeah.
Yes,
some
yes,
percent.
it does.
So, I mean, it's really hard to sit here and predict,
Yeah.
and how do you prevent it? I think the fact that we've had the health clinic, and we really are moving in the right direction, but other than that, it's out of our hands.
Right, but 4% of it is to pay for the affordable health care.
Ballpark, it's a range.
It's a range,
In that
yeah. So
ballpark.
we're
of-
all paying for it.
Yes, for the exchange system
Yeah.
that they're still working on. The back end of the system isn't quite finished yet.
Okay.
To get the enrollments to the insurance companies so that people can actually get cards.
Okay.
So they're still working on that.
Is the amount changing? I mean, the kind of, we're saying, what, 4% you say? Is that
Well,
that's pretty standardized, or is that just?
All the carriers are adding that into their normal renewal.
Okay, across
And it-
the board.
Across the board.
Okay.
All the carriers are doing that.
And then we'd have to
So-
wait till next year to see if that's enough.
Yeah.
I mean, it could be more next year, depending on what happens.
We'll see.
Okay.
In 10 days, on May 1st, the carriers will need to provide their new rates of the exchange to the Department of Health and Human Services. That will not be published to anyone. That'll all be, unless there's a leak. And October 1, we'll all see what the new rates will be based on the enrollments. And there's a lot of talk about, did they get enough young people? They said at the tail end, wow, a lot of young people signed up. That remains to be seen.
How many?
Right. Yeah, they needed 2 or 3 million young people.
Yeah,
Out of
right.
the 8 million, right. But it's interesting, in 10 days, the actuaries right now of the major carriers that are all part of the exchange are working feverishly day and night on the new rates based on what they're seeing. They haven't seen claims yet. They've only seen the demographics of the
Wow.
people enrolled, the ages. But they have an idea of what those claims will generate.
Joe?
This question, if they haven't finished the back end, and the back end's where people pay for it, how are they going to come up with actuarials in 10 days if they don't know who's paid?
Good question.
The federal government doesn't do anything.
Well, I understand
I
it's
can't
federal
answer those
government, but how are they gonna-
questions.
They only make us answer it.
I can't.
Goodness.
We only
I'm just
have-
curious, because if the back end's not done, how are they going to put that together in 10 days?
Very good question.
Okay.
That's why it's not going to be published. They may have to refine it a little bit. Gosh.
Any other questions on that? Thank you for sharing that.
Thanks.
And then the other scenarios, let's see here, it's moving. Jumped around on me there, but
Okay.
you can see, and actually this one moves right into option 2. This is the only one of the 6 slides where there's a net negative, where we would have an employee taking home less than they would. And again, this is with the IPA plan, which is a buy-up, so this plan would be an employee choice. And the others are net positive, all net positive. So, to recap, our recommendation is for option 1, and I'll just speak to the committee. The committee also formed a recommendation after a number of weeks of meeting and understanding where we were going, understanding each plan, and overwhelmingly, and after they got feedback from employees in their areas of coverage, they came back overwhelmingly with a recommendation for option 1 to stay status quo. So we're recommending option 1, and we're also recommending the overall 3% average increase for non-represented employees.
All right, any other questions? Joe?
Just a general comment. I was on that insurance committee when I was on the staff, and I know there's a lot of work that goes in there. So again, I just want to thank employees stepping up and who worked on that committee to try to get through all of these issues here with insurance. So again, just a thank you for the employees that were on that committee. And I think it's always important too. Your responsibility also being on that committee is to make sure you get as much as that feedback back from your employees on which plans, and I appreciate that as well.
Bill?
In addition to that, I'd certainly like to thank the manager and all the staff that worked on having this presentation on the 21st of April and not the 21st of May like we had last year. Getting the information up ahead, getting it out early, it's thorough. I think we learned a lot of lessons from last year, and that, I think, was very positive. So I appreciate everyone's effort to get that done.
Thank you, Bill. Good point. Sherry?
I appreciate your recommendations, and personally, I think those are good recommendations. They're solid. I like the fact you did base them on what the people using the plan and listen to the people using the plan. I think in the last year, we've done a lot of education on the high deductible plans, because I think there was a lot of, the year before, people didn't understand that those are the ones that you get to keep your doctor, and I want to make sure that when we say you get to keep your doctor, that there is those options, and that we tell people, like you said, there are a few people that are not going to, and I'm glad that you're being honest with them and you're going to track them down and let them know that they're not going to be covered. So I think you're within the ballpark and with the costs and everything. So I think option one's our way to go. Thank you.
Thank you.
No? Yeah, and just to, I think we echo everything they said, the idea that this was truly vetted and time was taken and came up with proposals and then went back out again and talked to everybody. So anybody that's unhappy with it, they had their opportunity to speak up, and so they just need to adjust for the decision making. But I appreciate all the work and the attitude of everybody. It was pretty fantastic. So thank you, and thank you, Rick and Ray, for being here tonight. I really appreciate it. I know. I want to say, this is my other brother.
It's a my brother.
I held back.
It's good.
Okay.
It's all good.
Let's give Kim a moment to get at the table.
Can we pre-identify a spot to take a break in the next 30
Sure.
minutes or so?
Do you want to do it now? All right.
I don't need it right. But once this
Okay.
gets rolling,
Okay, so you want to wait 15 more minutes, or you want to wait till 6:30?
I don't know how.
What do you
well-
think you're
Good
going
break
to, how long
point.
do you think you're going to take, Kim?
Well, I can be done in 20 minutes if I go straight through,
Yes.
but that doesn't count Larry's part. But there is a natural there is a natural break. Yeah.
Mary, I wouldn't take that, I tell you.
There is a break where I finish the revenue piece, and then we have a policy discussion. So that would be, a
Okay, that would
natural
be-
time.
That would be
yes.
great if you could do that. That would be wonderful.
That's priceless.
That's perfect, okay. All right, so let me have an announce to the public that we're now receive information on and discuss the estimated fiscal year of 2014-15 revenues. Ken Bradford, Interim Budget Research Manager, and of course, our Director, Larry Lang. So go ahead, Kim.
Thank you, Mayor. Good evening, Mayor and Council. Thank you so much for the opportunity to present this evening. As you know, over the past several months, we've been doing a lot of work to refine our revenue estimates for fiscal year 15, and so we're pleased to review those with you this evening. Before we get started, just a quick glimpse at our budget development process. We've seen this a number of times. We really have started this conversation back in November at the council retreat. And you'll see highlighted in red this evening's meeting, so we're right in the middle, right in the thick of things. And the revenue presentation today is really kind of a foundation to the expenditure discussion and the recommended supplementals that we will have next week. So quickly, our agenda, I will touch on our existing budget policies, which we did review at the council retreat, so I'll be brief in reviewing the status of those. We'll talk about all the revenue projections for fiscal year 15, and that is for all funds, so we'll spend some time on the general fund. I'll review the property tax estimates and our assessed valuation and what that's looking like for next fiscal year. All the enterprise funds, so looking at what those revenues are for all those components, including the stadium. And then, as I mentioned, Larry has some slides at the end where we'll have some policy discussion and seek direction from council in regards to our utility funds. So I'll go into our budget policies. Over the next few slides, I've shown all of our current budget policies, and we did revisit these at the council retreat in November. went through all of them, and the direction at that time was to keep them as they are today. And so over the next few slides, I'll display those, but I just want to make note that they are what's in place today, and we did not make any changes to those. So on this slide, we have our operating budget policies, and you can see we are in full compliance with those. This is our debt management policies, and again, we are in compliance with all of those. And I want to call your attention to the last one on this slide. When we met with the council in the retreat, this is the one that we were not in compliance with. We were a little bit over the 10% threshold that we try to maintain. And that was done at the time that we decided to purchase the Veneta complex. Even though the dollar amount stayed the same, because we switched it from an operating cost, a lease cost, to debt service on a purchase, thought that was a fiscally responsible decision and figured it would be 1 to 2 years before we were back in compliance with that. And so as we were preparing our projections for this fiscal year, looking at fiscal year 13 actual revenues, and then our estimates for where we think we're going to come in this year, and our projections for fiscal 15, we are now at 9.6%, and so very excited to say that we are now in full compliance with that policy.
Good, Joe.
What's that?
Is that good?
Just question.
Oh, I'm sorry, Joe.
The one slide back, I think it's one slide back. Hang on a second.
It's enthusiasm on that.
Operating.
Excuse me, go back to that other one where she said we're now in compliance. Can I hear some enthusiasm, please? I think that was your,
The one that-
that was your question last time, okay.
I still think 10's a little high, but that's okay.
We're down 9.6.
The question I have is on the replacement equipment. Do we need to get more specific in that debt management? We talk about, I'm trying to find it here, where we have the funding. Is it the first line?
In it, first one, short-term borrowing for lease purchase,
No, I'm
operating
talking.
equipment.
This is slide 5.
No, first slide. Replacement of equipment will be funded through the depreciation replacement reserve. Do you think we need to get a little more specific on that? Because you could afford 10, you could fund 10% of it and still be in compliance, because there is nothing there that talks about your equipment replacements, schedule and what percentage are we looking to be, you know what I mean, by funded. So it's kind of a very broad statement there. Just throw that out.
Go ahead, Larry. Go ahead.
I think as we go over the next year, we can look to see if we want to get more specific in that.
Okay.
One thing that you'll see in this budget as we go in the next few weeks is we're starting to, beyond the replacement vehicle one that we've had for quite some time, we're looking at all the other equipment and a lot of other measures. And a lot of our departments are working on asset management programs and how we're going to fund those. And I think we can put together a program for that over the next 12 months that'll show us a long ways on that. And I would really rather not change this until we've had a chance to see all of that.
Yeah, I'm not asking you to change it now. Just want you to consider kind of refining that a little bit, because it's very general, so.
And one other additional point is that allows us to have the flexibility based on a council policy direction on initiatives and what the funding level is for those each fiscal year.
That gives
So
us what we
some
wanted.
flexibility.
We called for flexibility.
Right.
If you remember, that was one of the things.
So this slide shows our budget policies, again, full compliance with all of those. And then our revenue and capital budget policies. And so this is one of our key performance measures, being in 100% compliance with our adopted policies. So we're very excited to report that we have met that objective for fiscal year 15. And also, this is something that's a key contributor when our rating agencies look at our financial stability and where we are in compliance. And so it's something that really contributed to our bond rating being upgraded this year. So very excited about that. Any questions on this segment before I move to the general fund?
Go ahead, Kim.
So we'll focus on the general fund for the next few slides. Before I get into the numbers, wanted to just review some of the key assumptions that led to the numbers that you'll see. So the property tax, we have our assumptions here. We have a 6% increase, which is the maximum change allowable by our assessor's office. We received documentation from the county stating what our maximum allowable increase is. And this is based on our assessed valuation, and I'll go into what that looks like for this year as well. Our non-construction sales tax, we're using a 4% growth assumption, and that's consistent with what we've adopted in our development impact fees and our land use assumptions, so keeping that consistent. Our construction sales tax, we held that steady from this fiscal year. As you know, that's one-time funds, and that's really dependent on what's going on in the economic activity, so we held that flat for this next fiscal year. And then our development-related revenue, what we did is we examined our trends and where we've been budgeting and what we've been receiving in actual revenues. And we took the midpoint of what we budgeted for fiscal year 14 and where we project will come in at the end of this year, and I'll show some numbers on the next slide. But that really gives us a sense of maintaining that conservative approach. We don't want to overestimate those revenues, and also bases it on the amount of expected work. So we don't want to budget for the maximum. We still have flexibility if we see peaks, but it's what we would expect to see coming in. Yes.
Bill?
Yes. I was trying to fast forward through the slides because I know I read it yesterday. The construction sales tax, the actuals, though, have been far greater than we've anticipated.
Correct.
So is that?
That's correct.
Okay. So we're actually going to hold that back in a very conservative approach when we start looking at these one-time monies for the next fiscal year.
Right, and some of the key drivers for that, we've had some significant projects going on, namely the 303 I-10, which has held our higher than normal estimates. And so knowing that those projects, and especially that one in particular, is coming to a close, that those revenues will change, and so we don't want to overestimate, and so we kept it flat for next year.
And the additional revenue that we collect, this is, again, I'm asking a question I don't know the answer to, but the additional money that we collect above what we budget becomes a one-time carryover to the next fiscal year, so.
Correct.
And we're only using those for one-time monies.
Correct. That becomes part of our fund balance, and is one-time money available for various things that we'll talk about next week as far as one-time budget initiatives.
Okay. Thank you.
Joe?
I like the approach, because if you get too far out in front, you've committed money to spend on something you don't have, as opposed when it hits the one-time fund at the end and you have an extra, million or two, you can use that money that you have real cash for a project, and you know what you have to spend. So I appreciate being a little more conservative on that construction, because there are some projects down the road that we may want to do, and we may not want to bond, but if we have enough cash in there, the cash will pay for it. So I appreciate that.
So this pie chart is an overview, and I'll get into some of the detailed numbers on the next slide, but you can see here overall our general fund revenue projections for next year is $79.2 million. Of that, we have the 73.2, which is our ongoing, and then the one-time that we were talking about is that $6 million construction sales tax. And just for a little bit of context, this year our one-time and ongoing combined was 73.2, and so we're right at about an 8.1% increase. And if you recall, back in February, we were doing some preliminary estimates of where we thought we would come in, and this is right on target with that. So I'll cover some of those details on the numbers here. So you'll see on here we have our adopted budget for fiscal year 14, and then where we're projecting coming in at the end of this fiscal year, and then our fiscal year 15 revenue estimates. And so as we were just talking about, you can see we're trending high as far as our revenues in total. We're about 9% above what we budgeted. And obviously, we still have a little bit to go, so we'll be monitoring that as we go through the next couple of months. But overall, we're seeing very strong numbers in our sales tax, our development-related revenue, and then, as we talked about, our construction sales tax.
Joe?
Whatever happened to that, was it the Autoloo, the one that in the governor's budget, they were looking to sweep more of that, and then did that ever get into the city pot? Do you know? Remember there was that fight over the, what was it, the Autoloo? Which is the one that...
The one I'm recalling was the lottery funds, the LTAF.
Was it the LTAF?
And the LTAF 2, the courts held that they couldn't take it because it had been committed, but the LTAF 1 The old lottery funds that we had for years, those are gone,
Yeah.
haven't seen them since. And
What's-
those are the ones I recall.
What's the fund where and I might be getting the fund name wrong, what's the fund in which they were trying to put some of the money back in, which they had swept over the past few years? Was
This
it-
past year, the highway user revenue
User
fund,
fund.
that was the issue.
Yeah.
Did any of that money come back into the city, or did it end up still being,
We collect highway user revenue fund today. As far as what they were talking legislatively, I haven't seen enough in the budget. The 28th, we're supposed to have a call on it to find out.
Okay.
But our estimates, the impacts of what they would have added in wouldn't materially change this budget at this point.
okay.
So just a couple things to point out on here. In regards to the property tax, this is reflective of only our primary portion. As I mentioned, I'll talk in more detail about the property tax overall in a second. But that primary portion is what supports our general fund operations, so you'll see just that portion here. And then again, our development-related revenue, you can see we're right at that midpoint between what we budgeted and where we estimate coming in. Were there any questions on those pieces before I
Any
get into
questions?
property tax?
No, thank you. Nice presentation.
So this slide shows our historical assessed valuation, which is really what our property tax revenue is based on. And so you'll see right in the middle there is our peak back in fiscal year '09, where we had $1 billion in assessed
All those were the
valuation.
days, huh?
Yes, yes. And then you'll see, although because there's a 2-year lag, we really started to see the effects on our city budget in fiscal year '11, where we saw the decline in our overall assessed valuation. And we've been seeing a decline every year until this year. So we projected earlier with calls with the assessor's office that we would come in about a 9% increase, and we actually came in at 11%. And so our assessed valuation total for this year is $659 million.
Joe?
Just, Kim, for clarification, since you have a primary assessed valuation and secondary, is that the combination of both?
Secondary.
This is a secondary, this assessed valuation, okay.
So the assessed valuation is really, as I mentioned, the foundation for our total levy, which is the amount of revenue that we can collect. And so you'll see here we've broken down the primary and the secondary, and it's important to note because we have the primary that supports our general operations that goes to the general fund, and then our secondary, which covers our general obligation debt service requirements. I've also noted on here the policy correlation. So our primary property tax levy for fiscal year 15 is $7.4 million, and you'll see there that we have a 2% increase, which is our truth in taxation amount, and that's the maximum amount that we can increase the primary levy. And what we have is a total of $418,000 difference from last year. And that increase, you'll see in there on the slide, $145,000 of that is really the truth in taxation increase, and the rest is attributable to new growth that we've seen, so new property coming
I think
online.
that's really good this time that you're showing the new growth underneath that. I think that's very helpful, anybody looking online and viewing this. So, Joe?
We had an earlier conversation about seeing if we could do the same thing for the secondary. Is Larry going to be covering that, or whether we can
No.
break out the new growth and
We have, 4% is attributable to new growth. That's our overall.
4%? So on the secondary, we can assume that increase, we can break that down, 4% new growth, the difference? Is that?
Just asking, on the first slide you've shown, on the
Primary,
primary, you showed
the-
the 273, 62, 360 as new growth. And I'm assuming your question is... if
I'm trying to break it
correct.
down for the secondary as well, because I know it makes it a little more complicated, but you've got two pieces on there. You've got actually what the increase is for people who were here last year, and then the second part is covered by new buildings that have been brought on board. So your actual increase of 7% or whatever that is not your total increase for the individuals that were here, because part of that is new growth. So I was just wondering, I like what you did with the primary, breaking it out. And it doesn't have to be right now, Larry. I mean, if we can figure out what how that breaks down on the secondary, that increase there, that, what is it, 400,000 roughly, what percentage of that, breaks down as new growth, and what percentage of that breaks down as existing? Again, you don't have to calculate it now, but I think it would be helpful.
Okay.
Okay.
Thank you, Vice Mayor.
Defer on that.
Bill?
On this, we always have, every year we have this discussion about levy and rate and all the rest of that.
What you're going to say.
And I'm, again, asking the theoretical question to what I already know the answer to. But if we take this slide and ask this or break it down, I think, the 2% increase of truth in taxation, is that, what if we chose not to do it? Let me just say it that way. What if we chose not to do that 2% increase? Do we even have that option? And what does that look like? What does that look like what effect does that have on the community next year or the year after or the year after? We'll start with that one.
Okay,
Not just on the cost outlay, but on what it does to the quality of life.
That's what I mean, for the
Okay,
overall
so-
revenue for the city. What does that look like to us as a community?
Because people, when you say, what does it cost, they're thinking the dollar bill, but I want to make sure it balances with the quality of life.
Yeah, and I'm not trying to narrow it down to the cost per resident. I'm talking about impact costs.
right.
Okay.
And I think I understand, and I'm glad that you've qualified it that way, because it's a
Yes.
lot harder to define mathematically. First of all, you do have an option. You do not have to increase by that amount. And some municipalities choose to do that. I talked to one community the other day, it'll be nameless because it was a confidential conversation, not held in a public environment, but one community that held that. And now this year, as they're looking at it, they're having problems balancing their general fund, and to make it up, now all of a sudden you're doing twice as much a year later. So there's a number of variables. I'd have to do a calculation to do the math anyway, and I'm not sure that that's what you're asking. I think what you have here at that 2% increase is you have a predictable pattern that in the long term, you're able to know that portion of your revenue, what is happening with it and where it's going. And that allows you, as you do your long-term planning on your general fund, that allows you a good plan of where you're going to go and how it is. A person reasonably would argue that our city, with 47% of our general fund, and Kim showed you that slide a while back, coming from non-construction sales tax, and roughly, what was it, about 10, 11, I forgot to look, but 10 or 11% coming from the primary property tax, the sense of balance between those, it's not like it's a level stool, if you will, that we're keeping in balance. So you start reducing the one, you're creating a further dependence on the other.
Just like these other cities are having trouble with because of that. So,
Yeah.
yeah.
Did that
And
answer
that
it?
becomes the cost to us as a
Correct.
community down the road.
Then there was the situation in the mid-2000s where some cities, including Goodyear, were not levying the maximum primary amount. An initiative was taken to the voters that said, hey, if they're not levying it, they obviously don't need it, and so it permanently went away. And the impact to Goodyear on that was about $1.5 million per year.
And the impact on the public was their quality of life and what we could do.
Correct.
Okay, so just,
So the second part of this question then, so the way that we have chosen to overcome this particular issue is the concept of the floating rate, where we reached the peak last year of $1.90. This year it'll be $1.86 or $1.87. Next year it'll be a little bit lower and a little bit lower as it progresses back down to $1.60.
There are two answers to the question. Yes, because of the floating rate. But the second half is that the city council has established a policy, about 3 years ago, I think you added this, maybe it's a little longer, that says that you will implement the truth in taxation, the maximum primary levy each year. That's a policy decision. Obviously, this group can change that policy decision, but that's the other aspect of it, and that was the basis for that decision at that point, and we have followed that in all of our projections.
And I think I just wanted to try to clarify that.
'Cause it'll still come up,
Yeah,
it's-
no matter what, it still
Yeah, it
will
comes
come
up.
out twisted and not intentionally. It's a very convoluted concept, so thanks, Larry.
Joe?
And to go back to the other policy, that you're not going to sell general obligation bonds unless you have the combined rate over $1.60, go back to your other policy on the construction sales tax. If you can conservatively estimate that and you come in with an extra $1 million or $2 million, then it'll allow you to build up a fund so you can pay cash for something because you may not be selling bonds for a while. So, I mean, it has its value in piggybacking on the prior statement that you made on being conservative on that one-time money. So that could be helpful with a fund of doing still some projects but paying cash as opposed to borrowing.
And so just to round out the discussion on the total property tax levy, you'll see combined with the primary and secondary, we're at 11.9 million. And as mentioned, that secondary is a floating calculation that is necessary to cover our existing debt obligations for GO bonds that were previously issued. So quickly, just some historical data on our levy and also our tax rate, which is a calculation in order to get the levy amount. So you'll see that even though we've been fluctuating, our total tax levy is still well below where we were seeing it peak back in fiscal year 10. It's about 20% less. And also, one important piece to point out is that we have the property tax rate in our calculated levy, and this is just a small portion of a total property tax bill that a citizen sees. So we have the city portion, and then there's frequently other assessments from counties or school districts. So we're talking about the city piece here. So you'll see that based on that 11.9 for fiscal year 15, our total property tax rate, as was just mentioned, is actually going down from what we currently have. It's currently established at $1.90, and that calculation of the rate for fiscal year 15 is $1.87, and that's per $1,000 of tax value.
Joe?
What's the commercial shifting this year, Larry? The assessed value or percentage?
You don't happen to have the exact one, do you?
Is that on there?
No, it isn't on that. I believe that it goes down another 0.5% from, I think it goes down to 19%. It was at 19.5%. So I believe, but I'd have to look for the exact amount. But it is going down another 0.5%.
Another half a point, that's what I wasn't quite
Okay,
sure.
right.
So that shifts.
That shifts the levy, and that's where it gets complicated
Right.
to say, our total levy is going up by 7.27%. It'd be nice to be able to say, okay, property taxpayers, each one of you, that's what's going to happen. But the reality is, some go up faster than others because of the complications in the formulas.
And because of the commercial shift, they're going to pay a little less, and residential pay a little more because...
Exactly.
And that started 2 years ago,
Yeah, right.
I think.
Yeah, and actually, there was a time where it was actually 25%,
Yeah.
and they phased it to 20,
Yeah.
and then they started it up again, and I
Right.
believe it's at 19 now or so.
So,
Okay.
Thanks, Joe, for bringing that up.
We can get that for you. Anything else before we move to enterprise?
Any questions on that last part?
So again, quickly, we'll just review some of the assumptions that were used to generate the revenue projections. For water and wastewater, we did assume our current rate structure, and we'll talk a little bit more about that in a moment. And you'll see we didn't use the standard 4%. We used a 3.5% growth calculation, and that's based on some trending information as far as where we're seeing actual consumption numbers come in. So again, being conservative and making sure we're not overestimating. And then for sanitation, you'll see again that 4% that I spoke of earlier, which is consistent with our general growth projections citywide.
You have a question, Bill?
I do. And I wrestled with this when I read it and couldn't formulate the question, and I'm not sure that I'm going to be able to right now either. We're anticipating a 4% growth in service delivery, correct? But not necessarily a 4% growth in the we're not growing the fee 4%.
Correct.
So and I think that was my first look at that was, we're going to do a 4% rate increase? This isn't rate increase. This is not rate.
Right, the rates are not changing. This is strictly based on new growth that we expect, which would generate additional user fee revenue.
Yeah, and as I worked through this, then that became apparent, but I think if someone's looking at this and they go, oh, sure, 4% growth,
Yes.
here we go again.
Great clarification.
Joe?
Thank you.
No, I was just agreeing to it.
Okay.
For the other two funds that will go through, the Stadium and the Highway User Revenue Fund, or HERF as we call it, there are a couple pieces to that entire revenue slice. So we have revenues that we actually receive for those funds, and then we have general fund transfers that make up the total revenue piece. And so I'll go through the details of what those look like for next fiscal year. So for our Water Revenue Fund, you'll see we're projecting $12.7 million for next fiscal year. The big green slice there is our user fees. That's 83% of our revenue projections, and that is the revenue we receive as a result of users paying their bills. We also have service connections and disconnections revenues that you'll see there at 7% of our revenue. And then our other, which includes transfers and debt service from impact fees.
Joe?
Larry, as a result of our new deposit that we put in for the water a while back, what is our uncollectible percentages running now? Do you know?
I'd have to get back to you. They have dropped a bit, but they still exist. I think we should get you just a trended analysis.
If you would, how that's trending to see if that's starting to be more manageable. Thanks. Just a thought. I want to make sure I didn't forget it, so I want to get that out there. Thanks.
For wastewater, we have $13.2 million. Again, you'll see the user fees are the main portion of that revenue. And also important to note here, and what's different is that that does factor in revenue from the Perryville Prison as we provide wastewater service there. And then in the other category, we have debt service transfers from the development impact fees that help pay for our debt service for wastewater. Sanitation, barely perceptible there, but we have 99%, again, user revenue fees, and so that's based on what users pay both for contained and uncontained sanitation pickup. And then the other, the $45,000, is for revenue that we receive as a result of additional cans that are purchased throughout the year. Some people have additional. And so for the sanitation fund, we have $6.7 million. This is the Stadium Fund. We have a total of $9.6 million. We will start with the green slice, which is our biggest portion, and that is a debt service transfer from the general fund over to the Stadium Fund, and that covers our Public Improvement Corporation debt service that we pay today. Then the orange and red slices, that's our actual revenue that we receive as a result of activity out at the ballpark. For non-spring training activities, you'll see we are estimating $500,000. We are one of 10 facilities in the valley that have this amenity, and we have 22% of the current market share of non-spring training activity. So we're very comfortable with where we are. That's consistent with what we've seen as far as our revenue in previous years. And same with the spring training revenue at $1.2 million. That's based strictly on the activity that we see between that end of February and end of March timeframe, specifically associated with spring training activity. So total, we have $1.7 million in actual revenue from those events. And I just want to point out that we are basing this on fiscal year 13 actuals. So this is what we received in actuals. We're in the process right now of reconciling and identifying what those revenues look like for the season that just completed. But we always budget based a year behind because of the timing. But we do feel like we're going to come in a little bit higher. And so what that means is that translates to an impact on that blue slice, which is the operational transfer from the general fund. So as our event revenues go up, the need for that transfer goes down. And so the $2.5 million is the operating transfer. That's what we are projecting for fiscal year 15. And that is a maximum amount. And I just want to talk a little bit about what makes that up and how that may fluctuate depending on how the expenditures come in and our revenues. So we have a total of 2.5 that does contemplate one-time supplementals that are recommended for next year. So again, this is dependent on council discussion and direction that we will have next week. It also includes the $250,000 capital replacement fund obligation that we have per agreement with the teams. And so when you take those two factors out, the actual operational subsidy itself is in that 2.2 million range, which is where we have been for the past several years. So I just wanted to kind of identify what's making up that 2.5, and that rounds out the entire picture of the 9.6 million. The other important piece to point out is if those expenditures come in lower, we don't automatically transfer that amount in. And so what we do is we work both closely with the budget office and the ballpark team on where their expenditures are coming in, and then we only transfer the amount that's actually needed to cover those operations.
Bill?
Kim, I realize next week we're going to talk about expenditures. In that, are we going to have a breakdown of what those non-stadium-related expenses are that other departments provide to the stadium, police, fire? There's we have this discussion every year about how much did it cost the police department to provide service to the ballpark, how much, and we struggle to get that information. At least my memory says we do. So if that's something we can get a look at.
Yes, thank you, Mayor and Councilmember Stipp. What we'll do next week, we'll talk about what the overall budget is for Parks and Recreation. I can cover what portion of that is related to the ballpark division. We do have, we actually just got the numbers for our police and fire amount for this past season, which was right about $100,000. And again, that's very consistent with where we've been over the past several years. But what we'll do is we'll highlight out of that total Parks and Recreation budget, what portion of that is the actual operations for the ballpark and what that contains.
Yeah, because I think that'll be very helpful, especially as we talk on the expenditure side, because I think that there's some expenditures coming, new supplementals coming this way regarding the operations side of the ballpark that I think would be important.
Yes, correct.
Thanks.
I also want to just note that in regards to the overtime, we also don't put that into the base budget, so those are budgeted within police and fire, and then we actually do that transfer based on actuals. So again, we don't have a certain set amount, and they just get that transfer no matter what. It's based on the actuals, so I'll include that. And then our Highway User Revenue Fund, we have a total of $6.1 million. 3.7 of that is our state shared revenue, and that is actual information that we received from the Arizona League of Cities, and that is right on par with what we received this fiscal year. And then the transfers is the 39% that makes up the remaining revenue, and that covers the difference between what the state gives us and our actual cost of operations. And I wanted to note that that also does include our pavement management program, so that total amount of the work that we do each spring is incorporated within that transfer. So that's the total picture. I don't know if there's any questions on this or any portion before we transition to Larry or possibly take a break.
Questions?
It
Joe?
may have showed up in here, the actual transfer from the enterprise fund to the general fund for their costs associated that the general fund provides those services.
That's 2.8, isn't it?
I believe so.
Yeah, there's a couple of items. There's the enterprise funds transfer $2.8 million, and that, when I say the enterprise funds, that's water, wastewater, and sanitation. All three of those transfers are meant to cover the cost of billing services, insurance, and everything from the general fund. In addition, we do property tax in lieu payment, so that if they were a private enterprise, they'd be paying it. That's $900,000, and that goes to the general fund also.
And you say the total's about 2 point?
It's 2.8. It is, yeah.
2.8 is the
For the
transfer from those. We have not reallocated that in the past few years. That came from a cost allocation plan several years ago. We did cut it, I think, a little bit, but we have not reallocated it at this point in time. It's part of the priority-based budgeting that may be looked at just a little more, but that number came quite some time, and that we've just held it steady.
Yeah, you just kind of led into my second question is, are you planning on just taking a look to see if that 2.8 is correct or needs to be adjusted?
Because of the rate study that's going on right now, we've looked a little bit at it, but in the long term, we'll probably in the next year or two need to start looking at an updated cost allocation plan.
Okay.
So this is the transition to Larry to talk about some policy discussion in regards to the utility revenue. And so I don't know if you want to just continue on, or if you wanted a natural break time.
This is probably a good time
Yes.
to take a break. So 10 minutes, is that enough, or do you spit it out?
I think
10 minutes? All right, 10 minutes.
Could drive to
Okay.
here as we're going. We do, as Kim mentioned, have a few policy questions we just want to discuss a little bit. As you'll recall, on March 17th, about a month ago, our water rate consultant was in giving you an update on the water rate study, the water and wastewater rate study. A few things that they talked about were the costs of our system and operating our systems are increasing dramatically. Some of those increases are for inflation, general increases, chemicals, electricity, insurance. As our infrastructure gets older, you have the repair and replacement of it. And then we've got some significant issues on water resources that we're going to need to address. At the time we talked about that, he gave some trended averages that said that utility rates have been increasing 5 to 6% per year, and that's kind of a national study is what he was referring to, and that there actually is an expectation for those rates to increase to about triple over the next 15 years. Well, as part of that issue, we also talked about the long-term issues that we need to deal with in Goodyear. The CAP water, the delivery of it, and one of the things that the consultant and also Bob Beckley, who was up here with them, mentioned is that with the formation that the City Council already did of a citizens committee to look at the rates, to look at integrated water master plan and some of that early information. It's going to be January 1st of 2016 before we could have a rate implemented through that study. The last implementation that we adopted was effective January 1st of 2013. And the discussion held that evening, and what I'm following up on this evening, is that in the interim, we should do a rate increase to cover just our costs of normal doing business. This isn't the costs of some of these other costs that we've been talking about, but a lot of that is also so that you avoid, or at least we reduce the risk of a real larger jump as we go later. To go from 2013 to 16, a person could easily argue that our costs just for the same operation should go up by about 15 to 20%. So what we're proposing is an interim rate increase that will take effect January 1st of 2015, It's an overall 5% increase to the water and wastewater revenue. Our consultant ran the calculations for us, but this is revenue-based and not cost-based. And his point in making that is that he did not want any of you to feel that this rate increase would be covering all costs of operations. The things that we've talked about, that'll be talked with the committee over the next year and so forth. And I felt comfortable that everyone understood that in the meeting, but wanted to put it out to you tonight. So the reason I'm bringing it up is that for us to consider that, for you to actually vote on doing that increase, we have to do a few things. One is we have to post on our website tomorrow or by Wednesday a 60-day notice of our intent to do this. And that actually, I believe, has to be on the homepage of the website by statute. 30 days from now, under a different statute, we also have to post a notice of a public hearing so that June 23rd, you can actually consider this issue. So we want to begin, pending any comments that you have tonight, we want to begin that posting process so you can consider it in June when it's being talked about. So the proposed rates that would be in here, basically what we're proposing in this, in the short term, is to increase the water rates, but not increase the wastewater rates. That will generate an overall average of about a 5% increase in the rates, but it'll just be on the water side of the equation. So a higher water user will be impacted more than a lower water user, but it's in the water area, and I think when you look at the supplementals that did not get funded from a budget standpoint, you saw some important areas in the water area that were not funded. And that's part of the strategy of this, is to have those rates on the water side. And Mayor?
Sherry. Excuse me, Sherry.
Larry, and I don't know why it's broken down like this, and maybe you can help me. You have non-residential and school, they're broken out, but they're the same. Is there normally a different rate for schools, or is that something we don't do and other people do?
Thank you for a question I can't answer.
I wouldn't stump the Larry.
No, that is what it's actually interesting because I was prepared for a slightly different one than that. The commercial rates get broken into categories for various reasons over time. And in fact, as we go forward in this study, I think you might see some of those change. The commercial and the school, I think, got combined into this rate at our last rate study, and I believe before that they were different rates for the schools versus the commercial at that point in time. They got put together, but then didn't get combined in the resolution that adopted them. It's a very good question. I could probably do a little more research, but I don't think it's as scientific as what you suggested there.
No, I just saw it. I didn't know if there was like a special rate for schools that we didn't do and why it was broken down, so I appreciate that.
Yeah. As part of the study and as part of the committee that will be formed, they will take a look at the rates by category. For example, we have received feedback from the multi-users group that our rates, from their perspective, penalize apartment buildings on a per-unit basis. We need that to be looked at. That needs to be addressed and to see if it is.
I've heard that before. They have
Yeah.
spoken about that before.
So that needs to be addressed. And so as you change structures, and our consultant pointed it out a month ago when he visited with you, you want to change your structures as little as possible because you create winners and losers when you do it. If my rate doesn't go up as much as your rate, then I win and so forth. But there are times where you just have to do those, and I think that working that through, the analysis that we're doing in the rate study, working it through the committee, working it through the various meetings we'll have with you, will be the appropriate time to have that dialogue on that.
Joe?
Just for clarification, Larry, is it because of the meter size of the water coming in, it costs them so much, as opposed to having a bunch of half-inch meters? Is that the reason for the apartment issue?
Well, and of course, structurally, I can't envision having three-quarter-inch meters for each apartment
No, I
unit,
understand that, but is that the reason why?
When you do the calculation and doing their calculation, they were dividing the water used and the total fees paid by the apartment, by the number of apartments, and comparing that to what single-family residential would pay. So from their point of view, it was an apples-to-apples comparison. It'll be looked at completely on that basis, because even on that basis, if the calculation indeed works that way, we should bring that forth and have a dialogue on it to see what it is. And if you look at this rate structure, what happens in the rate structure is, the low rate for non-residential is $3. Well, the low rate for residential is $1.18. But you have different bases where those numbers hit. For someone that uses less than 6,000 gallons of water, well, that probably would be a typical apartment person
Right.
in their domestic use. So that would come into play in the discussion.
Thank you.
Okay.
So it's not so much the meter size, it's because it's starting at 0 to 40,000 is probably where the problem is.
I think it is. It's in
Okay.
the structure. And it doesn't mean you would look at multifamily and they have to be exactly the same rate as non-residential or school. It could be that there's a more appropriate rate structure, and that's where the comparison to other communities will be looked at as part of this group. When I met with that individual, he actually came and talked to me, and he wasn't aware we were doing a rate study. We told him about the committee, and I suggested strongly that his group, one of his apartment owners or something, make sure that they've applied to be on that committee so that they can provide that input. So the impacts of the proposed rate adjustment, we put this in just to kind of get a perspective, and part of why it's kind of similar to the property tax question that we had earlier. Does this mean my rates will go up by 5%? First, we looked at combined water and wastewater, and the answer is yes, your rates will go up 5% if you are using somewhere about 20, maybe 2,000 gallons of water with 8,000 gallons of wastewater. That's about where it will break even. Lower water users will have less of an impact. Higher water users will have a greater impact.
Changes.
It never does change on that. Now, also, I want to point out to you, we did not, in the revenue analysis that Kim just presented to you earlier this evening, that analysis did not take into account this adjustment. We did not want to get ahead of you that we hadn't even had this conversation. What we've talked about is that, assuming the city council is supportive of this rate increase, we would be able to increase the water budget for 6 months' worth of revenue, and that funding would be available to assist in the CAP recharging program that Mark Holmes has been wanting to fund and to fund at higher levels.
Your Honor?
Sherry?
Your Honor.
Your Honor. It's Mayor Lord, so.
Your Honor.
Judge. I told Larry you didn't. So. Okay, you can tell me to go away on this, but one thing is I think our water bills are very hard to read, and if we are going to be changing the rates, I'd like if we could look at the bill as part of, maybe the committee, make it easier to read. And I know APS and Southwest Gas, once we get the new rates in place, do something that really help you, that little chart that says this is how much you did use last year as to this time, that really helps you monitor, did I use more than last year or less than last year? Because I think simpler would be better, because if we're going to change the rates, I think looking at the bills very kind of scary. And they're not going to, people may not know off the top of where to add the percentage or what they're looking at. And those little graphs and like APS has, you say, oh, I used less power this year, I conserved, I did good. So if we could maybe look at that as part of the committee, I'd appreciate that.
Yeah, thank you. Actually, I think combining a few things with our, with the ERP project as we're looking at software, the committee input as to what would be, I think that those are, I use those graphs all the time on our various utilities, and I agree with you.
That's a good idea. Joe?
This is why, I kind of felt, and again, I understand the strategy, but our outreach program is going to come into place, a lot of it, as we start to work on the study, and you're going to have an increase before that happens. I was hoping maybe our outreach program would have been before we would have done this, so people understand why we're actually, proposing this increase and what that impact is, and how it affects the CAP, GRD, all these future things coming down the road, so we've got to stay ahead of this. So that's kind of my biggest concern. Are we going to, if this takes place, if we do this and comes into play, are we going to be able to, are we chasing our tail, or, are we in front of it? I guess that's where I'm kind of coming
Well,
from.
Mike, I just want to add to that is that we, if anything this council has said, every budget year, water is going to go up.
Yep.
We've not hidden that at all. We have said it will be continuous, and that has been put out into the public. When we go out to speak, we say water is gold. So, I understand the technical part and the part you're saying about, because that kind of process is very, very good to have, and have it within the time frame that you're talking about. But as far as the public, I don't feel quite as guilty at this, because we've said it before. And if you remember, we did it in a certain time frame, and then we actually held back during that 1 year when the downturn. So we actually said to the public, hey, we know you're in pain on this, we're going to hold off, and that's what we did for that increase. But never have we said to them, and we will not say to them, that water will not increase. We are in the desert, and we are in a drought, and they read the papers, California, Nevada, you name them, the western states are all in, all under the same pressure. So, but I'm not saying not to have the program, Joe. I'm just saying that I just want to make sure that we don't give the impression we haven't talked about it before.
We have, but to me, there's a difference in saying we're raising our weights and explaining why we're doing it. And that's why I'm a real stickler on this outreach program, because there are so many dynamics that are moving right now with the GARD, what it's going to cost us to replenish, why this is actually going up, not just because of our operations, that I think it's important that this should follow any type of increase, so that they're getting educated why this is happening and how. I realize we're in a desert, but you've got wet water, you've got dry water, you've got GRD, you've got the cost of recharge, you've got all of these pieces that are driving these costs. And I would prefer to give them more than just that it's going up. So that's why, I've been pushing this.
I don't disagree with you that the best way to have done it, but we're there now. And the fact of the matter is, I do not want to wait, because I'm not ready to have a big, deep cut the next time and raising it and saying, okay, well, this time we're tripling what we did. I just, that part bothers me.
I would
Molly?
hope, if we do decide to move forward, that in between the 60-day and the 30-day, that we really ramp up getting the information out of why we're doing what we're doing. And then, especially at the public hearing, we need to tell why we're doing what we're doing. But with electricity rates going up and everything else going up, we've got to, we don't want to lose money, and we've got to recover the cost that it costs us to provide that service to them.
Don't disagree. I like the cart before the horse. But
I
no,
know, and I
understand.
agree with you, Joe, but maybe we can just do a better job of explaining it as we go.
I think if I could, because I think you have outlined some things that have been talked about very clear, but I just wanted to, as part of it, and I know it wasn't anything implied otherwise, but our communications staff, I think, has done an excellent job of keeping water issues in the forefront in the newsletters, and what you have talked about, what this group has directed to us, what the communications staff has talked about, what city manager has talked about, is that we need to broaden those efforts into as many different means of communication as we can, and I think that's the message that we as staff have from all of you on the city council. But I wanted to point out, I do think we have been doing some of that, but like in focus and some of those articles, and they've done a pretty good job.
Okay,
Go ahead.
what's next?
With that, I'm going to turn it back to Kim.
Oh,
Kim?
okay.
I just have the wrap-up here. Basically, last week, we set the stage for the base budgets and what departments are doing currently with their current budgets. And with the revenue discussion today, that really leads us to next week, which is a work session on our expenditures. And that is really focused on the council's chance to discuss those recommendations. Less talking from me, more answering questions or letting you guys talk as far as what we're recommending for next year. You'll see we also have planned immediately following that a public budget forum, which we'll hold here on Wednesday, April 30th at 6 o'clock, where we'll give a presentation on the overall budget, and that then leads to the presentation at the work session on May 5th to council about the draft budget. So quite a lot of activity as we head into May 19th and adopting the tentative budget. So appreciate that. Thank you. That's all I have. Thank you.
Are we finished now?
That's it.
Okay, all right. Any other comments or questions? All right. City Manager, do you have anything for us?
Mayor and council, nothing on this topic, but I was advised that we did get, our police Canine did get another award, and so we just heard that today, so it's, I thought, good to point out. On April 5th, there was something called the Desert Dogs Canine Trials, and we actually had, there were 60 teams from around the country, U.S. and Mexico also, and they did things like drug explosive detection. They also did area and building search, tactical challenge and obedience, and also handler protection. One of our officers, White and Dog Rudy, took first place in the building search, which also got them into what they call the tough dog entry. Now, I don't know how they did in the tough dog entry, but I will tell you they have bragging rights for the building search of first place. So congratulations to Officer White and Rudy. And that's all I have.
That's it. Anything from council reporting on anything? All right, let me just let the public know that on the 28th, we have a work session and a regular meeting. Starts at 4:30, the work session. So with that, meeting adjourned.
Good job. Good job.